Well, good afternoon, everyone. Welcome to the lecture series from Legal Aid of North Carolina that supports our eviction diversion program in Durham, North Carolina. Legal Aid of North Carolina is a statewide program. We serve all 100 counties. We end up opening about 25,000 actual legal cases a year and serve another 25 to 30,000 people through our outreach, including events like this. You'll be hearing more about this from Alexis and Dietrich, but I wanted to take a moment and introduce our speaker today. First, let me say a few words about the eviction diversion program. Peter Gilbert and his team, Sarah and Brent and the team have done extraordinary work. They're one of the first programs in the country to do eviction diversion. They've done an outstanding job. They've been the model for programs all over the country. Which has been especially forceful and impactful during this time in the pandemic. Our partner in this in Durham has been the Duke Civil Justice Clinic, so I wanted to give a shout out to them. The lecture series has brought some terrific authors and speakers about poverty. In the past, we've had Richard Rothstein and Catherine Flowers, and now in keeping with that tradition of having national experts, I'm delighted that today we have Gene Nichol, who's going to talk to us about poverty in general. Gene is a constitutional scholar. He's an author. He's uniquely qualified to talk about poverty, even though he is a constitutional scholar. We don't see many people crossing over into the area of poverty. And he's the director of the Poverty Center at UNC, and he's published brilliantly books, The Faces of Poverty in North Carolina. He's done some tremendous op-eds in support of Legal Aid of North Carolina and legal services and access to justice all over the country. He was instrumental in helping the Poor People's Campaign launch. Did a tremendous bus tour here in North Carolina. So a constitutional law scholar that can talk in real terms and with feeling and heart about poverty is unique. And we're delighted to have him. Gene is the former dean of the law school at the University of Colorado. Also, he's the former dean at the University of North Carolina Law School. He was the president of William and Mary. And currently, he's the Boyd Tinsley Distinguished Professor of Law at the University of North Carolina. And we are privileged and delighted to have him today, Gene Nichol.
Thank you very much, George. I appreciate those generous remarks. It's good to see you. I'm fortunate that George and I are old friends, both very old by this point. And I am, as ever, honored to be involved with any program which has to do with Legal Aid of North Carolina. I think the great and powerful institution committed to achieving justice in this state. When I think of my good colleagues and friends at Legal Aid, I'm reminded always of Daniel Webster's claim that we are charged to do the great work of human beings on this earth, achieving justice. No one does that better than Legal Aid of North Carolina. So it's an honor to be with you. I'm delighted to see the unfolding of this, the Durham diversion work and the Durham Rental Assistance Fund. Peter Gilbert was one of my students before he started raising so much hell all over North Carolina. And so I'm remarkably proud of him. I understand there's something of a fundraising component to these letters. So just to let my feelings be known, here I've got two checks here that are going in, one to Legal Aid of North Carolina and another one to the Durham Rental Assistance Fund. So I hope you will join me in that venture.
Wow, thank you.
I wanted to start with a moment of silence or repose, perhaps. I watched the testimony a couple days ago of those heroic Capitol Police and their colleagues on January 6th. They are astonishing heroes faced with grotesque challenges. I particularly have had in my mind, as I know many of you had, Officer Harry Dunn, who facing beatings, hand-to-hand combat for some 4 hours, seeing his colleagues killed, was then surrounded by these villainous terrorists, screaming that he was a fucking nigger. The thought that this continues to occur in the United States, and thinking of those who do it, those who aid and abet it, those who cover it up, even those in North Carolina who were involved in that venture, is worse than heartbreaking and nation demeaning. I was thinking too that the all-white caucuses, Senate and House caucuses of the North Carolina General Assembly, will now instruct us on what can be said and learned in our schools about those events. And so it wouldn't surprise you to hear that our teachers were required to say that these were tourists roaming the halls of the Capitol. Just ponder that for a second. I get to read a little more in the summer than I do otherwise during the rest of the year. I wanted to start with a couple of quotes relevant to your work, beginning some years back that I've been dwelling on. Jimmy Carter, you'll remember him, said in a speech about 40 years ago now, talking about civil justice and access to civil justice, that 90% of the lawyers in the United States represent 10% of the people. Americans are over-lawyered and underrepresented. You good folks at Legal Aid are our effective but overwrought counterweight to that true Carter statement. We all face as lawyers the burden of this largest transgression in the American civil justice system, the fact that 80% of low-income folks are priced out of the effective use of the civil justice system. Secondly, related to that and related to your work, I've been reading some of the works of Lord Bramh, who's a 19th century Scottish lawyer. And he issued a charge 140 years ago, not just 40 years ago, that is more essential today than even when he spoke it. Bramh said, "It was the boast of Augustus that he found Rome brick and left it marble, a phrase not unworthy of a great prince. But how much nobler would our sovereign's boast be when he shall say that he found law dear and left it cheap, found it a sealed book and left it a living letter, found it the patrimony of the rich and left it the inheritance of the poor, found it the two-edged sword of craft and oppression and left it the staff of honesty and the shield of innocence." Imagine that, those who have found law the patrimony of the rich and left it the inheritance of the poor. You are the Archbenders of North Carolina life, and it's an honor to be with you. Third, and maybe more surprisingly, to those who don't know me quite as well, there's been some new work released in translation of the Dead Sea Scrolls. I don't know if there are any religion scholars among you. But this new translation puts, or new documentation from the Dead Sea Scrolls, puts this in the word of Jesus, relevant to the era of Trump. Quote, "Speak truth, each man to his neighbor, and render truth and justice in your streets." Rendering truth and justice in your streets. The work of you good heroes. So I'm honored to be part of this. I want to talk to you about your constant companion, poverty in North Carolina. I know in many ways you are more familiar with it, closer up even than I am, though I do spend my days in low-income communities. But I want to talk to you about poverty in North Carolina. I'll talk a little bit, sort of at the end, about this eviction crisis that we face, though, as I'll concede, I'm not an expert like a lot of folks who are with us today are on that front. But I want to start with a couple stories and maybe a couple updates, and then I'll move more broadly, if that's okay with you. In the last 20 years, Hickory, North Carolina has experienced immensely trying economic times. The pressures and alterations of global trade hit Hickory hard. Furniture and textile jobs, the core of Hickory's economy, disappeared with dispatch, with NAFTA. In 2000, think about this, Hickory's unemployment rate was a little less than 2%, well below state and national averages. I didn't know anybody ever had a 1.5% unemployment rate. But by 2010, a decade later, it had soared to almost 16%, one of the 4 sharpest city unemployment increases in the United States in the last decade. So a small bucolic manufacturing mecca had become an economic disaster zone, and it has largely stayed that way. For the first time, homelessness has become a daunting problem in Hickory. The Salvation Army Shelter of Hope is pressed well beyond its capacity. As a result, some 200 or so wounded souls live in the woods surrounding town. They patch together makeshift cardboard lean-tos and dilapidated tents, keeping a wary eye for police and complaining neighbors. In summer, the camps bear the oppressive markers of the South, as you can imagine. Intense heat, draining humidity, sudden rainstorms, relentless mosquitoes, yellow jackets, gnats, and snakes. In winter, snow and frost pose distinct and direct dangers. More than one homeless struggler has perished against the cold. About a third of those living out are women. Some are kids, though their parents, understandably fearing abuse and neglect proceedings, work hard to hide them. Roger Cornett and the 15 or so volunteers of the Open Door Homeless Relief Project, which is run out of the basement of a tiny Baptist church in nearby Conover, North Carolina, spend much of their days and nights and almost all of their scant resources trying to keep people living in the woods of Hickory whole, safe, well, and alive. Cornett is a 65-year-old retired businessman who suffers from a debilitating neuromuscular disorder. He doesn't look the part of the heart on the sleeve do-gooder as he crisscrosses the county in a battered pickup truck, NRA sticker prominently displayed. But Cornett and his cohorts venture into often dangerous campgrounds, distributing tents, tarps, food, cook stoves, utensils, propane cylinders, blankets, trash bags, clothing, portable heaters, and even dog food. I couldn't believe that people were being left to live like animals in my own home county, he says. A thin man in his 30s named Bill Stock tells me that a lot of us would be dead out here without Roger and his people. You learn not to look vulnerable, he says. A woman has to get with a man or she'll get hurt. Making the point, Cornette introduced me to a lesbian couple living along the woodlines. Janet Teal was raped, beaten, and stabbed 2 days before we talked. She showed me 13 stab wounds. The sight was sickening. Cornette had helped to subdue the assailant. I don't know how long we're going to last out here, Teal conceded. When we talked, Marcia Stimson, who was 47, reported that she'd lived in the Salvation Army shelter and was there for the 3rd time. I'm one of the best bell ringers they've got, a top producer, but you have to leave after 3 months, and I haven't been able to afford to make enough money to eat and keep a place to live. You know, when you hear people say, if it wasn't for my spouse, I'd be poor, that's me, she says. She spoke with precision, but without emotion. I was self-employed, doing pretty well, working in finance, but my business crashed. I lost my job, my income, my apartment, my car. I don't fit the norms, she tells me. I'm not in the right categories. I don't have any addictions. I don't drink. I don't smoke. I don't do drugs. I don't have any kids. I'm not pregnant. I don't have medical issues. I don't have mental illness. I've been advised to act like I'm crazy, but I won't. There's no funding for someone like me. I'm almost 50, she said, and it's really bad now, but I worry what it's going to be like when I'm older. Stimson's lived in the woods surrounding Hickory for months at a time for years. I'm self-sufficient, she said. For ages, I wouldn't apply for food stamps. It was too embarrassing. She recounts the hard cycle. I work, save a little money, and I try to get housing like I was working at Healthy Home Market in Hickory, but it closed and I lost my apartment. At first, I liked the thought of living outside, she told me. I always enjoyed camping, but she quickly learned you got to be secretive all the time. If people find out where you are, they'll call the cops or they'll steal all your stuff or worse. She lived most of the time with a friend, Dave, so other men would generally leave her alone. But even then, she didn't feel safe. She said, to tell you the truth, in the middle of the night, I find raccoons even more frightening than men. Stimson packs all her belongings in a trash bag each morning and took them with her so no one would steal them. When I'd come back, she'd sneak past the mobile homes near the road, she said. If they saw her there, they'd report her. The morning wasn't as bad. She's an early riser, and so she'd get out of the woods by 5. They didn't even have to worry so much about being seen. She was shocked when she first came to Hickory. There were hundreds of people living in the woods, lots living in their cars, a lot more couch hopping, going from place to place. There are some amazing folks here, she said, like the open door folks, Rogers, but mostly no one can stand the sight of homeless people. We give them the creeps. In words I haven't been able to forget, Stimson explained, when you've lost your job and you've lost your savings and you lost your home and your car, and then I even lost my cat, who was very dear to me. I know that sounds stupid or funny, but losing my cat hurt me deeply. Because when you lose everything, you lose your sense of being a person. You lose your own independent identity, your own space to fill in the world. It's hard to remember you're still a human being, that you have a chance at a decent life, or that you even deserved one, that you are worthy of existence. I wrote most of that 3 years ago, but I've been meeting a lot again of late with the remarkable Hickory folks. Roger Cornette and his colleagues minister still to well over 150 stressed and often broken souls living out. Unemployment, crushingly, has returned to elevated levels, higher than in 2017, with potent job losses, of course, experienced in manufacturing and textile and hospitality sectors. By 2020, the Hickory metropolitan area faced one of the highest jobless rates in North Carolina. And Cornett explains, even if you can find work, you can't make ends meet on $9 or $10 an hour, not with housing, groceries, food, electricity, a car, gas. Lots of folks here still fall between the cracks. They want to work and defend for themselves, but they can't manage it. A bunch of the families I talked to, he says, would like to help their troubled relatives, take them into their own places, but they can't pull it off. They've got small houses themselves. They really can't afford to rent themselves. Hickory desperately needs affordable housing, but we don't have enough of it. Chaplain Cornett's personal burden has been amplified. Now in his late 60s, Cornett's neuromuscular disorder has progressed. He's now forced to undergo a more wrenching therapy regime, and his doctors demanded that he limit his trips into the woods. A younger, heartful, and courageous chaplain, James Herman, has taken point on Open Doors outreach efforts in the homeless camps. Though Cornett still runs the ministry 24 hours a day, finds the resources to sustain the work, and inspires other volunteer troops to keep folks in Catawba County from starving or freezing to death. Still, Cornett acknowledges, given his immune system challenges, I'm lucky that working in the woods of Hickory for almost a decade hasn't killed me. 4 campers close to Cornett have died in the last several months. Hickory needs to do more. It's obvious. People know it, he says. He's asked the city council to please come out with me and see the folks trying to eke out an existence in the woods of your town. But none have ever been willing to come out with me. Still, he's resolute. We'll keep fighting, keep on operating, keeping people from starving, keeping people alive. He adds, I want to do more. I don't know how to do it. We have the heart, but we don't have the resources. I worry that I'm sort of a failure at this fundraising business. I wish people had more of a heart for the people who are struggling here day in and day out. It's broader than homelessness and living in the woods. People can't afford a decent and safe place to live. They want to be secure and happy and proud in where they live. It used to be different, but who can afford to get by on minimum wage these days? We need to have more empathy for what people actually face. Poverty is insidious in North Carolina. It creates a downward spiral that can almost be impossible to escape. It is destroying North Carolina and the United States. That's the first story. Second, Evan Ashkin is a doctor of family medicine at the UNC Medical School. He serves patients at Prospect Hill Community Center in southern Caswell County, where a majority of those he sees are Spanish-speaking and poor. Almost half are farmers, Black, white, Latino. A quarter are on Medicaid, 30% get Medicare, and 40% are uninsured. They don't fit the proper stereotype, lazy freeloaders looking to game the system and get a free handout. That viewpoint is possible, Evan tells me, only if you've never worked with anyone in this patient population. I've never met a freeloader here. His patients are simply people in excruciating circumstances, in intense distress, arising from circumstances beyond their control. They're waiters, gardeners, farmhands, motel workers, dishwashers, day laborers, retail employees, housekeepers, and ironically, home healthcare workers. Maybe these lawmakers ought to come down here to Caswell County and get to know them, he indicates. Ashkin describes the choices restricting healthcare triggers. The man comes in with chest pains, but he's uninsured. Do we give him the stress test we would offer if he could pay? The clinic can't afford to continually pay for expensive procedures. So maybe the patient gets the test, maybe not. When the doctor guesses, if he guesses wrong, what if the patient has a heart attack? We say we couldn't stand to have a two-tier health system or to have rationing of health care, but this is rationing via the wallet biopsy, the worst possible basis to allocate care. One of Ashkin's patients is undocumented and has lived in Caswell County for 7 years after fleeing violent abuse in Mexico. She was in significant distress early in the pregnancy, bleeding badly in need of an ultrasound, presenting the serious possibility of ectopic pregnancy. Because of constraints on public funding for her care, the clinic is hard-pressed to provide the ultrasound she needs. And if it does, that decision may work to foreclose important scans late in the pregnancy, essential to protect both mom and the baby. The baby will be a citizen, as are his siblings, suggesting how artificial non-citizen funding restrictions can be. So I have to help the mother through this horrible choice, he says, a choice that no other mother should ever be required to make. No one but a poor person would ever have to make such a choice in North Carolina. We want to avoid an early sonogram, but if we guess wrong, it might prove disastrous. Ashkin mentions what he calls the brother-sister test. Would I think it tolerable that my sister had to make such a choice? I believe that healthcare is a human right, he tells me. I also believe that on a purely economic argument or basis, the claim to extend Medicaid is unassailable. Locally, regionally, nationwide, we are doing ourselves a huge disservice. Ideology is overcoming rational common sense decision-making, and it has taken a hideous toll on my clients, he says, some of the most vulnerable people in North Carolina. A couple of weeks ago, Dr. Ashkin told me that North Carolina's continuing refusal to accept Medicaid expansion, now unlike 39 other states, including DC, cut short the lives and capabilities of his patients. It poses great and heartbreaking frustration in his practice. Even with the support of the health center, these hardworking folks can't get in to see specialists, to see the specialists they need to treat diabetes, to see, for example, to get screenings, colonoscopies, medicines, and tests that they absolutely require. No one likes to hear it, but they sometimes die. They die when they should survive. They die when you think about it because they live in North Carolina. They die because they are Tar Heels. For very poor people, even a $20 copay, he says, can add up and it can pose its own obstacles. We see all the time that people are delaying care or not getting essential services. It happened dramatically with regard to COVID. A lot of preventive services are just unaffordable for folks. With preventive care beyond reach, conditions that could be caught and managed deteriorate. Health is low on the list until you get acutely ill. With Medicaid expansion, we'd be able to keep people well and have them actually have better outcomes and reduce emergency room utilizations and preventable hospitalizations. That has been shown over and over and over again, he says. It's not some pie in the sky. It's simply what happens when people can get access to healthcare. It saves money, it saves lives. The refusal to expand Medicaid in North Carolina works a hideous toll on my patients. Politics overrides good sense and human decency, he says. Now, speaking more broadly, before the outbreak of the devastating COVID-19 pandemic last March 2020, North Carolina had experienced, consistent with the nation's long economic expansion, some modest reductions in poverty, though the overall figures remained bleak. In 2018, 14% of Tar Heels were impoverished. And in 2019, the percentage fell to 13.6%, 1.4 million North Carolinians. As ever, North Carolina's poverty rate was a good deal higher than the national average, exceeding the federal standard by 3%, reflecting the 13th highest rate among the states. Over half of North Carolina's total income is captured by the top 20% of residents. Nearly a quarter of its total income went to the top 5%. Racial income disparity has continued here undiminished. 1 out of 4 Native Americans and 1 in 5 Black and Latinx Tar Heels live in poverty. Most impoverished people of all races are women. 786,000 women and 600,000 men live in poverty. And the burden of economic hardship falls most dramatically on the youngest. 1 in 5 North Carolina children now lives in poverty. 22% of kids under 5. Over 615,000 Tar Heels live in extreme poverty on incomes less than half the federal poverty threshold, which is $25,750 for a family of 4. North Carolina also has, as you likely know, one of the very highest rates among the states of poverty level low wage jobs. My colleague Heather Hunt reports that 39% of all North Carolina full-time, full-year workers make less than 2/3 of the state's median wage. Therefore, they earn less than $28,000 a year. Contrary to the lore, these low-wage workers aren't kids seeking to get a little work experience before they head off to Stanford. Over 61% of North Carolina low-wage workers are aged 25 to 64. Nearly 6 out of 10 Latinx workers are included in the category, and 48% of African Americans. 44% of women and 33% of men in North Carolina are low-wage workers. Matthew Desmond, who I hope you've read, has written eloquently of these effectively impoverished workers. The working poor, he says, are not primarily teenagers bagging groceries or scooping ice creams in paper hats. They're adults and often parents wiping down hotel showers and toilets, taking food orders and bussing tables, eviscerating children at meatpacking plants, minding kids at 24-hour daycare centers, picking berries, emptying trash cans, stacking grocery shelves at midnight, driving taxis and Uber. And then, of course, there's the COVID. North Carolina didn't cause the COVID-19 pandemic, but its legislative steps to target poor people in the last decade have clearly increased the wounds suffered in COVID by Tar Heels. When Republicans secured unfettered control of all 3 branches of state government in 2013, they immediately passed 2 cornerstones of their economic policy agenda. First, as a lot of you know, they immediately and literally gutted the state's unemployment compensation program, assuring that it became, as it remains today, the most tight-fisted plan in the country. Representative Julia Howard, architect of the unemployment, quote, reforms, said the old approach had grown too rich. It was becoming a welfare scheme. Labor scholars called the changes a, quote, radical reduction in benefits for people unemployed through no fault of their own. By 2019, only 8.6 of North Carolina's jobless workers were receiving unemployment, placing the state 51st in the nation when DC and Puerto Rico are included. Our average duration of benefits, 8.6 weeks, had shrunk to the country's lowest. In 2018, 2.5 years ago, Wayne Vroman of the Urban Institute, who had conducted an extensive study of the unemployment system in North Carolina, explained to our legislative committees that our worst to be found program fiercely underserved the state's workers. Legislators seemed to beam in appreciation. Representative Dana Bumgardner, a Gaston County Republican, replied to the testimony without irony. I think where we are is a good thing. What is the point of your presentation? Last place, no regrets, in other words. Soon, and second, the General Assembly also enacted, as noted, a statute permanently rejecting Medicaid expansion under the Affordable Care Act, though the federal government would have paid almost the entirety of the tab. In each of the 8 years since, lawmakers have maintained the odd and stubborn rejectionist stance. By 2021, this year, North Carolina had become one of only 12 states turning aside federal support, even after an array of Republican-led legislatures had accepted the expansion. By the onset of COVID-19, an estimated 634,000 poor Tar Heels would have secured affordable health care coverage through Medicaid if the state was willing to accept expansion. 60% of those in the coverage gap were members of working families. 20% of Tar Heel adults are uninsured, the 7th highest rate in the nation. Then came the disease, death, and unemployment of the virus. A national study from mid-2020 found that an astonishing 5.4 million Americans had lost their health care coverage as a result of pandemic-caused unemployment, likely the steepest increase ever recorded. The researchers concluded that nearly half, 46%, of all the increases in the uninsured resulting from COVID-19 came from just 5 states: California, Texas, Florida, New York, and of course, North Carolina. 8 states now count more than 1 in 5 of their adults as uninsured, including Texas, Florida, Georgia, Mississippi, Oklahoma, and North Carolina. These 2 tragic decisions, intentionally gutting our unemployment compensation program and repeatedly rejecting federally subsidized health care for North Carolina's poorest citizens, dramatically increased the heartbreak now faced by incalculable numbers of our neighbors, families, and friends coming from the pandemic. Even when meeting during the pandemic itself, our lawmakers refused to budge on these ideological markers, these wounding political lines in the sand. Marrying unemployment woes and healthcare miseries, multitudes have been left to face a brutal plague in this state without compensation or care. Now, as I close, and as I mentioned, and many of you know, far better than I, in North Carolina, an eviction crisis also looms. 35% of Tar Heels are renters. Over 175,000 are behind on their rent. Over 60% of those are folks of color. Over 90% of them come from households making less than $50,000 a year. 1 in 4 Tar Heels today can't meet his or her expenses. 1 in 8 North Carolina households didn't get enough to eat last year as our eviction moratorium expires. An extension of it was rejected by a majority of the North Carolina Council of State. It would reportedly take $18 an hour to make rent in North Carolina these days, $25 an hour in Buncombe County, $22 an hour in Wake County. Tar Heels can't afford these prices, are the permanent marker on their economic and social record, which occurs from undergoing eviction. Low wages, high costs, life at the edge. As our friends at the Budget and Tax Center have found, work has increasingly fallen short of the promise that earnings can match the cost of housing, childcare, food, and transportation. More than 40% of North Carolina adults don't make enough to support a basic standard of living. That was true in 2018. It was expanded during COVID. It is true right now, today. It'll be true in 2024 and 2026. It's true even if the folks in the North Carolina House and Senate don't give a shit about it, which they don't. We should add, thinking of housing, that the National Low Income Housing Coalition testified this week in the Congress that nearly half of all states and more than 100 cities have spent less than 5% of their rental assistance allocations. Through June, 15 states had spent less than 2% of their funds. Amid that slow pace, 6.5 million households remain in need of rental assistance, and most are in areas of the country where the COVID-19 infection rate has surged due to the Delta variant. These struggles disproportionately affected renters of color, with 25% of Black renters behind on their monthly payments, compared to 10% of white renters. States and cities, renters, families simply need more time. Thomas Piketty, the massively influential inequality scholar from the Paris School of Economics, has argued that there is nothing natural in the way the American economy is organized. It is a matter of political choices, of ideology. In his 2020 book, Capital and Ideology, Piketty claimed that in the United States and its inequality regime, concentrations of wealth not witnessed for a century have been delivered by our version of hypercapitalism. The description echoes his earlier claims that economic polarization in the United States has now reached spectacular heights, and more broadly, that our level of economic inequality is, quote, higher than in any other society at any time in the past, anywhere in the world. He has added last month that for the first time in history, the poor are being blamed for their miseries, condemned for their lack of character, talent, diligence, sacrifice, and virtue, while the wealthy are lauded for their merit, genius, and entrepreneurialism. I'm not enough of an economics folk to meaningfully critique Piketty's damning conclusions. I can say, though, tragically, that his characterizations mirror the harshness of economic life in North Carolina in ways that ought to humiliate us as a people, especially if we're a people with the ideas and ideals that we profess. I'll stop there. I'm glad to take any questions that you have or accept any objections, but I appreciate getting to spend some time with you.
Gene, I want to thank you for speaking as part of our lecture series. We do have questions, many questions from the audience that I'll get to, but I want to start by expressing my appreciation for your ability to marry data and the stories of the people with whom you've so closely interacted over the years. I think that that type of partnering of stories and data really strengthens how we talk about the issues that you've so eloquently discussed. To the point about data, one of our attendees has asked where you've gotten this data about poverty because they're interested in using that for their own work.
Yeah, well, I run a poverty center. I spend a lot of time working on it. Much of the data, the great bulk of it, comes from the United States Census Bureau, which releases studies of poverty and income and wealth and average income for states, counties, cities across the United States every year. It's the most reliable and sort of compelling data that we have. There are a lot of folks in the United States who spend their whole careers trying to poke holes in it, but no one doubts its strength, and they're far and away the best numbers that academics have available. Mm-hmm. You should keep in mind too that those poverty figures are based on the federal poverty standard, which, as I mentioned, is about $25,000 a year for a family of four. I don't know anyone anywhere who thinks that you can live on $25,000 a year in North Carolina as a family of four who would be willing to undergo that experiment to see if it's conceivable. We had a fellow in the legislature a couple years ago who said that there were no real poor people in North Carolina. He somehow missed the 10% of children in North Carolina in his own district living in extreme poverty, and the many hundreds who are homeless. I offered to introduce them to him, but like Roger Cornett says, they tend not to take you up on it. I would just add this. I came to the conclusion a long time ago, 20 years ago, that it's important to have, like you said, Alexis, it's important to have data and it's important to have narrative. What we write, we write a lot of reports there available. We have books available, and anybody can just send me an email and I will give you all the data you might, I'll give you more data than you want, and you'll probably throw up over it eventually. But the reason it's important to have both, if you, a lot of poverty centers, poverty researchers just point to data, and data is crucial. But when you think about it, if you're trying to convince folks who are skeptical, well, if you go from having 12% poverty in your state to 18% or vice versa, somebody working in poverty knows how terrible and dramatic that is. But if you're reading it for the first time, you think, well, 12%, 18%, so what? Doesn't make any difference. So data alone tends to leave your work ignorable, drawing dust on the shelves. Narrative, it's much more powerful. It's much more difficult for people to honestly discard the stories from the mouths of people living in poverty in North Carolina. And I've spent a lot of time in the last 15 years doing thousands of interviews with low-income folks in North Carolina. On the other hand, I would say this: if you only use narrative, then skeptics will say, okay, you found a few people who are having a hard time of it, they probably deserve it. They're not representative of life in North Carolina. So you need both in trying to make the claim of hardship, which is shared so potently by so many of our sisters and brothers. Now, it's also true, I gotta be candid, that you also need someone who's willing to open his ears or her ears. And we don't have that in the halls of the General Assembly for the most part. So it has to be a broader effort. But few people know better the challenges of folks living in low-income communities than a lot of the people, the great people on this Zoom. And so I encourage you with all I've got to make those stories known as pervasively and as persuasively as you can?
I think that you have already hinted at the second question. I think it is important to understand that people can creatively interpret numbers, which seem so plain before them, but they can also dismiss these narratives, these stories as anecdotal evidence. And so our next question comes from an attendee who has asked, what can be done so that the North Carolina legislature accepts federal funding for North Carolina rather than reject that funding? What is it possible for each and every one of us to do in this Zoom room, perhaps individually or with our networks or with our communities?
Well, that's of course one of the great questions of life in North Carolina. I don't claim there's any easy answer to it. You can first do what I do, which is try to make the case to your lawmakers. And I try to make the case to those who are skeptical, and there are lots of them, as powerfully as you can. You need to remember too that, I don't know, one of my great heroes is Fannie Lou Hamer, and we need to take some care about what the likelihood of success and how that should affect our efforts, what it means. Fannie Lou Hamer didn't do an opinion poll before she started the Mississippi Freedom Democratic Party. And we have faced equal challenges in the past. Let me explain an example, though, of the difficulty of this challenge. Well, I haven't talked to a lot of legislative folks about Medicaid. I can say this, they make decisions every year. It's harsh to say this, but it's flatly true. They make decisions, the Republican caucus in the House and Senate, and that's where it is made. They make decisions every year, which mean that more than 1,000 of their sisters and brothers, low-income folks in North Carolina, will die. They cast votes which say, you're going to die. Now, that's just a fact. That's true. It's proven over and over again. Harvard has proved it. You don't have to take my word for it, but we've done a lot of studies indicating the same. I would think this. If I was making a decision, which meant that 1,000 of my sisters and brothers were going to die, I would goddamn well sure have a reason to explain why I did it. Now, you can ask these folks in North Carolina why they vote against expanding Medicaid. You'll have a hard time coming up with reasons. But first, we said, well, that's not the North Carolina way, or we need to reform our Medicaid system already, or we don't want to be handing out benefits to people who are undeserving. I have a friend I work with a lot who's a doctor who is a great advocate for Medicaid expansion. He said, you know what I find weird is, I'll talk about this. He's a physician down in Newbern. He says, I'll talk to the local Rotary Club, and people will raise objections saying, I don't like giving anything to somebody for free. Now, that means they need to study our American healthcare system a little more carefully. But the doctor says, you know, you would think that what we were doing was handing them a pot of gold or a bunch of gold bullion worth $100,000 for their. All we're saying is we've got people who are sick and we want to help them get well. But that's the sort of precursor that we move against. I'm gonna stop with this, but here's one way to think about it, or one example of what we face. We passed a law 4 years ago, requiring that a lot of work first recipients in North Carolina get drug tests. The legislature was very thrilled about it. They posted a lot about it. They talked about it around the country. They included in this new statute a requirement for a pilot program to report back in a year. This was maybe 2017. They said, because we want to study it and see how much money this has saved. They did the pilot program, it reported back, and fewer than 3% of those tested positive for the use of drugs. Now, I told some of them, I said, if you're just looking for positive results, you got to come up here to Chapel Hill. You walk across the campus, you get a 60% positive on any afternoon. You wouldn't even have to worry yourself about it. But fewer than 3% of folks tested positive. The guy who introduced the bill and required the pilot program said, I was shocked at that number. I believed that anyone on welfare in North Carolina is gaming the system and laying out taking drugs. I come from the Republican caucus where virtually everyone believes that. So this is great news. It's a huge surprise. Also, he had to admit we're spending boatloads of money on this testing program. And of course, it's only costing money, not yielding any savings. Then you could ask, did they do away with it? No, they didn't do away with it. We have folks who know virtually nothing about the lives of low-income folks in North Carolina. They don't care to change that. And knowing nothing, they fill that void by a bunch of assumptions about the habits and the unworthiness of low-income people and replace their lack of knowledge with that sort of ideological farce. That's what we face in North Carolina, so it's an uphill battle. My only real advice to everyone on every call we're on is we got to change this legislature. I started by mentioning this remarkable officer who's called Nigger as he's defending the democracy of the United States. Our legislature, it's all white caucuses, the all white Republican caucuses in the House and Senate will tell us what we can know about that, what we can hear about that, what we can learn about that. Astonishing as that is. It's not good to say it, but we need to change our government.
And with that, I am not allowed to voice an opinion, but I will now turn it to Dietrich McMillan, who is managing attorney for the Durham office, to offer our concluding remarks. I appreciate everything that you've had to say, and I appreciate the boldness with which you've said it.
Thank you. Hey, Deirdre.
Absolutely. Thank you, Professor Nichols, for your passion, for what you do, for helping those that are often dismissed. And we all know that poverty in the United States holds many people hostage, almost as if they were sentenced and then held prisoners from being able to experience life and liberty and the pursuit of happiness. Unfortunately, these sentences are passed down from generation to generation to generation. It is a sentence for which no crime has been committed, even though our society insists on treating it as the worst of possible offenses, and it's a shame. Our neighbors are living in poverty and are subjected to daily punishment and indignities. From the mountains to the sea, we see the demoralized men and women living in the shadow of poverty. We see those who struggle to make ends meet, just as Professor Nichols has stated, and who are pushed out of the places they have long called home, oftentimes retreating to the woods. As we leave the Zoom room today, and as we reflect on Professor Nichols' talk, let's be reminded of one of the poems by Langston Hughes, which I only read in portion. Look down upon the town in which you live and be ashamed. that such supine poverty exists there, that such stupid ignorance breeds children there behind such humble shelters of despair, that you yourselves have not the sense to care. Caring is a daily decision. It is a radical act. And I want to conclude this lecture by asking each of you to care about our fellow North Carolinians in this time and in their greatest time of need. As one of our clients has recently shared, what they need is not a handout, but a hand up. And at Legal Aid, we seek to extend that hand up while offering care and dignity through two of our great programs, the DEAR program and the Eviction Diversion program. And I am proud to serve along the men and women of these programs who advocates every day for our neighbors as the managing attorney. Our advocates in the DEAR program help men and women who have committed misdemeanor offenses as children and as young adults. And they help them get their records expunged and their licenses restored. And by doing this, families can move forward with their lives, breaking the chain of bondage and making a step towards defeating poverty for generations to come. Through the Eviction Diversion program, we help those who struggle to pay rent during this time of a pandemic, where it seems that many have lost their care. The advocates through the Eviction Diversion program has worked tirelessly during this time to extend a hand up to our neighbors so they can more easily breathe, knowing that they have a place to live and can continue to provide a safe, healthy, and stable home for their families. So today, will you join us in extending a hand up by either volunteering or by making a donation, so that together we can help eradicate poverty and create a more just and fair North Carolina. You may visit our website at legalaidnc.org/donate or /volunteer. Let's care. Let's extend a hand up for our neighbors. And I want to thank each and every one of you for joining us on this lecture series. A special thanks and gratitude to Professor Nichol for that wonderful lecture and reminding us to care. Thank you, and I hope each and every one of you have a great day.
Thank you, Dietrich. That was really excellent. Thank you, Jean. Maybe you and I can be in touch after the talk today so that any relevant articles that you want me to share out with folks, perhaps you can pass on those links to me. Sure. Does that work?
It does.
Okay.